Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will look into important H3N2 influenza virus. People are panicking across India as of now. There was panic and all. It is across every social media. Basically, ICMR has warned Indians in December. We came to know about this strain in December. People are comparing this with COVID. That is a main reason. So we will completely decode in depth all the details of this disease. How is it comparable to COVID, whether we can compare it with COVID, how different this is from COVID, how close it is to COVID. So we will decode everything from top to bottom for this H3N2 influenza virus. What is the disease caused by H3N2 influenza virus? See, basically we call it as influenza or flu, or we also call it as seasonal flu. There are four categories of virus, that is influenza virus A, B, C and D. Influenza virus A is very important to us. Previously there are two strains in it. One is H1N1, which caused pandemic in 2009 and we called it as swine flu. There were a lot of deaths across India because of this virus. And the current strain which is identified by ICMR in December is H3N2 virus, and it is rampant across India as of now. Then come to virus strain B. There are two types of virus in it. One is Yamagata and Victoria virus. Then come to C. C is very mild, though it causes mild, it attacks human beings. It causes very mild symptoms in human beings. And coming to D, it occurs only in cattle like cow, sheep and all other things. Now we will look into what is the reason for H3N2 influenza. Basically, this is a seasonal flu. Seasonal flu means you will get across the year, but in Western countries you will get only in some season, that is cold season. But in India we will get across the year. Why is it coming mainly at this stage? So we have undergone the pandemic of COVID. We are not exposed. We were very clean. We were very neat. There were no exposure to any pathogen for the last 3 years. So we lost the antibodies within our blood for this virus. That is the reason the attack is bit severe now. And also there is vaccine for influenza virus since 2009. It is available, but we were not taking it regularly. These are the three main reasons for the increase in the attack of this virus. Now we will look into the pathology of the virus. Pathology of the virus in the sense how the virus enters into the body, how it replicates, how it damages the human body. We will deeply look into it. This might be a mutation in the virus. So because we have not undergone through this infection for 3 to 4 for last 3 years, this might be a mutation. The incubation period for this virus is 1 to 2 days. The moment the virus enters into your body and the time it will take to show the symptoms is 1 to 2 days, that we call as incubation period. This virus is very fast spreading through aerosols and droplets. Aerosols, when we sneeze, when we cough, when we let out our sputum into the air, there will be small drops which will be suspended in the air. Those we will call as aerosols. And a little bigger drops that we call as droplets, they will not be suspended in the air. They will be dropping onto the floor or dropping onto the surface. So when other human beings come into contact with these surfaces and they inhale or they touch their mucosa, the virus enters into their body. After the virus enters into the body, these virus have receptors on the upper respiratory tract. Upper respiratory tract includes nose, pharynx and trachea and mouth. Anywhere these virus enters into your body through this mucosa, this virus enters into the cell and starts replicating there, and it will increase its number there. Once it increases its number there, it will try to damage all the cells of the lungs and other parts of the lungs. So primarily what happens is this will produce in some severe cases it will produce primary pneumonia. Primary pneumonia means the pneumonia that is occurred through virus. This will have breathing difficulty. It may reduce the oxygen saturation levels. When it goes beyond 1 to 3 weeks, what happens is secondary pneumonia by bacteria may cause after 1 to 3 weeks. It is very highly risky in the patients with heart attack or heart diseases. What is the conventional treatment? Conventional treatment in the sense, when you suspect that you have H3N2 influenza and you go to a doctor who is nearby you or a corporate hospital or a pulmonologist, the treatment given by them is conventional treatment. Normally this will be symptomatic. If you have fever, they will give medicines related to fever, medicines related to cough, cold. So whatever the symptom, if you have pains, medicines related to painkillers or something like that. It is mostly symptomatic. And ICMR has recommended a vaccine for this since 2009, but no one is using it. Maybe they can revive that vaccine, and people might start taking it. In severe cases, when the symptoms are going beyond the control, they can use antivirals. And also when there is secondary infections like secondary pneumonia, so they will also treat with antibiotics as well. Homeopathy can help the patients in two ways. One, it can prevent the disease. Two, when the disease has occurred, it can cure the disease completely. So we will look deeply how this is happening. First one is prevention. How it is prevented in homeopathy is, we have a concept called genus epidemicus in homeopathy. What it does is, we will collect the symptoms, all the symptoms, or as many as symptoms from different patients on this virus, attacked by this virus, and we will select a simillimum, which is a drug that is very close to almost all the symptoms or maximum symptoms within the group of patients. When we give such type of drug to a patient as a prevention, so it can do three things. One is, it can completely prevent the disease from occurring, or the homeopathy medicines, even though the disease is attacked, the severity of the symptoms will be very less, or the frequency of the symptoms can be less. And also the prognosis, the bad effects of the disease can be reduced when we use genus epidemicus in case of homeopathy to prevent the H3N2 influenza virus. And the next one is, once a patient is attacked by this virus and they come to the homeopathic clinic, we can treat the patient based on the symptomatology. So immediately we'll put him on the drugs, so that the severity of the symptoms is decreased, the frequency of the symptoms is decreased, and also the patient will not go into further complications with this treatment. Whatever the homeopathic treatment we give, whether it is for prevention or it is for cure once the disease has occurred within you, these will not have any side effects. Without side effects, we can treat the patients. The reason for this is, we will be using the medication in very small quantities. For example, you take allopathy or Ayurveda, any other system of medicine. There, the medicine they are going to use will be in milligrams or grams. But in homeopathic dilutions, the medicine is very low concentration, that is only in few picograms. And also, we use the concepts of nanotechnology to prepare homeopathic nanoparticles. We call them as succussion and trituration. The other name for succussion and the common name for succussion is froth flotation. With this, we make homeopathic nanoparticles. Every active ingredient will be surrounded by lactose molecules, and the lactose molecules are further surrounded by silicon molecules. This is a homeopathic nanoparticle. When we give this type of nanoparticles in a target specific way, it is going to attack only the disease, not the other parts of the human being, so that we will not have any side effects. This is the reason. And these nanoparticles are very effective. They work on the principle of hormesis. What the principle of hormesis says is, any substance you take in the world, in higher quantities it will kill a biological activity, in medium quantities it will inhibit a biological activity, and in very smaller quantities it stimulates the biological activity. In the same way, when we use these nanoparticles in very small amount, it will stimulate our body to prevent the disease, or it will stimulate our body to cure the disease, as in homeopathy. And also, homeopathy is very affordable. As you know that there are no patent rights given to any of the pharmaceutical companies in homeopathy, so they cannot have monopoly over a particular drug, and they cannot sell to the price what they want. As there are no patent rights, anyone can make the homeopathic medicines and they can sell it. So that's the reason homeopathic treatment is very affordable. I think everyone knows about the precautions, because whatever the precautions we have taken for COVID, same precautions are applicable here. First one is, try to get the vaccination, sit at home, unnecessarily don't go out, wear a mask, don't go into the crowded places, keep social distancing, have plenty of ventilation at home and at office, wash the hands with sanitizer or soap, maintain respiratory hygiene, avoid, if there is, take the symptomatic treatment, always clean the surfaces, avoid traveling, and try to be isolated when you get the symptoms. Take the flu vaccine. The patients with bronchial asthma or bronchitis or any other respiratory disease and heart diseases should be very careful because they have higher risk of going into primary pneumonia and secondary pneumonia in future. As per World Health Organization, this vaccine has to be taken and it is mandatory for few risk factor people. What are those? First one is pregnant women should be vaccinated. Next one is child between the age of 6 months and 5 years should be vaccinated, and also an elderly individual above the age of 65 should be vaccinated. Individuals with chronic medical conditions like heart diseases, lung diseases, or any other chronic kidney diseases should be, and also healthcare workers like doctors, nurses, and any other staff within the hospital should be vaccinated. Yeah, once you are diagnosed with this disease, take very good food, take mild food, don't take oily food or spicy food. Keep the things bland, take plenty of vegetables and fruits. And also, you have to take good rest because the body will be weak, and also, you have to have plenty of sleep. Do not exercise when you have this disease. What about the prognosis of the disease? It is not treated properly, or once you don't take care of it, what happens is you may land into primary pneumonia, the pneumonia which is caused by the virus. Sometimes after 1 to 3 weeks, if the symptoms are continued, it may land into secondary pneumonia due to bacteria and also respiratory failure, low levels of oxygen. Normally, it is a self-limiting disease. In 99.9% cases, there will not be any death. It is not so dangerous compared to COVID, but you have to be very careful. What you have to be very careful is very simple. If the disease occurs in clusters, from there new strains may occur. It is very difficult to control the new strains because we don't know how they behave. That is the reason, try to curtail this disease, try to isolate yourself and take all the precautions so that the disease will not spread. Thank you.